Breaking news. Nursing homes across the U.S. are reporting staffing shortages due to changes in immigration policies affecting their foreign-born workforce. Foreign-born workers comprise over 1/4 of direct care employees, a sector already facing high demand from an aging population. Policies initiated by the Trump administration have impacted various legal immigration pathways, including temporary protected status and visa approvals. The long-term effects on staffing levels and the caregiving industry remain uncertain. What do you think?
In a previous video, I talked about the so-called Big Beautiful Bill that reshaped how nursing homes operate and how, instead of increasing quality, it drove up administrative burden and corporate control while care staff continue to dwindle. But there's another layer to the staffing crisis no one wants to admit: immigration policy. Under this new administration, key visa programs that once allowed foreign-born workers to fill critical roles in healthcare, especially in long-term care, were quietly restricted or allowed to expire. That includes programs like the H-1C for nurses and reductions in employment-based visas and refugee admissions that historically helped staff these roles. For many facilities, immigrant workers weren't supplemental, they were essential. Immigrants make up nearly 1/4 of the direct care workforce in the United States. In some regions, they are the majority. They're the ones helping residents bathe, eat, transfer safely, and manage chronic conditions. These aren't jobs people are lining up for domestically. They're hard, often underpaid, and carry little prestige, yet they're foundational to elder care. So when immigration slows, the impact kicks fast. The Big Beautiful Bill added pressure on facilities to meet unrealistic standards without increasing reimbursement or even addressing the workforce supply. But at the same time, restrictions on legal immigration made it nearly impossible to fill vacant positions. That's not a coincidence. It's a compounding problem. Staffing shortages got worse. Facilities were forced to close units. Remaining staff burnt out or left entirely. Residents got less attention, more errors occurred, and families were left with no good options. This is the correlation no one is naming. Restrictive immigration policy plus punitive regulation equals a long-term care system in collapse. If we are serious about protecting our elders, we have to stop treating immigrant workers like an afterthought. They are the system. And until policy reflects that reality, these crises will keep multiplying.
So Trump's Big Beautiful Bill has passed. So what does this mean for us healthcare workers, especially us working in the hospital? Less staff, overworked, and underpaid. Let me break it down. Millions will be cut from Medicaid. Patients in and out of hospitals rely on Medicaid. Hospitals are obligated to still treat these patients, insured or not. Hospitals not getting paid. And if a hospital's not getting paid, hospitals definitely shutting down. This will directly affect the underserved communities and hospitals. So less hospitals in the community is available trying to treat an already growing population. Our hospital is already packed as it is. Packed! So now there's going to be a delay in care, which essentially means sicker patients, placing more stress on healthcare workers. I don't know. This is the perfect time to step away from bedside, because if we're already overworked and understaffed as it is, it's going to get worse. And y'all not about to stress my ass out. Shit.
Something for you all to think about. We are in such a climate right now that we already know nursing homes were not the best choice, but for some people, that is the only choice. And then after COVID, it really became one of the not so great choices. So not only do we have facilities that are not operating as they should, care is not being provided as it should be, now we have other crises such as home health care and home services can't find staffing. So your typical skilled home health, which is your occupational physical therapy, and the nurse would come out after like a hospitalization or surgery. I'm having clients to call me saying, look, they're telling us they can't come out for a week to 7 to 10 days, which is unheard of. They can't find therapists, they can't find nurses, they can't find home health caregivers, bath aides, and the same thing with our home services, which is non-skilled. These are the home caregivers, the chore workers. They can't find suitable employees to staff their agencies either. So we are in a pickle. What are you going to do? It may not be your turn just yet, or you may be on this journey and you see that this is coming. Think about some options. What are you going to do? Will you find a personal care home if it's available in your area? Are you going to look into respite care? And I would strongly encourage you, don't wait till the last minute. If there's a way that you can go ahead and register your loved one, get them on the books at some adult daycare, respite home, find you a personal caregiver that you can put on retainer. Because when I tell you right now, the pickings are so very, very slim. This is one of the reasons why I don't just run the business, but I also do respite care. I also go out and do private duty services. I also do nightly check-ins. I'm not too big for that, and it's a part of my business. It's a service that I offer. So I found that it's easier for me to strategize. How can I be a solution to some of these problems on an individual basis instead of going to open a home healthcare company where you can't find staffing? It doesn't make sense. So I just caution you to stop, right now and kind of think about, in the next 2 years, where will we be with this? Because if we can't find staffing now, a lot of nurses are traveling. They've given up bedside. They're not local anymore. So everybody is suffering for staffing. What are we going to do? How are we going to fix this? What will be the answer in the future? Who knows? But let's get to planning, y'all, because this is serious.
Hello, Find the Dot family. Today we are talking about something that touched thousands of homes across America. The shortage of nursing staff in nursing home. A challenge made even harder by recent laws and immigration policy. This is a story stitched together by the original video creator, and we give them full credit for bringing this issue out. Sit back, grab your coffee, and relax.
The United States is facing a critical issue, a nursing shortage. According to experts, the shortage is only expected to intensify as baby boomers age. Many states have turned to immigration to help lessen the impact, but as the White House's immigration crackdown intensifies, will we continue to be a nation that attracts much-needed nurses?
Tense situation in South Denver this morning when a staffing shortage caused a nursing home to call 911 for help. Michael Abeda is following this story for you tonight. And Michael, luckily there is a positive outcome here, and you're going to explain that. But this also illustrates how close we may be to a serious problem.
Yeah, Kelly, there was a positive outcome in this situation. But like you said, it really emphasizes just how much strain is on our healthcare system right now.
Engine 36, respond to assist EMS code 9 at 3131 South Federal Boulevard.
Saturday morning, first responders were called to a nursing home in South Denver. A source familiar with the situation says there was a staffing shortage, one nurse for 50 residents. That nurse requested that 20 patients be transported to the emergency room due to no staff.
I told her that would overwhelm the system.
There were signs on the door of the care center that state they have a COVID outbreak. In the end, no one was transported to the hospital. Denver Health ambulances stayed outside the facility until the early afternoon.
We are officially going to close down ETAC 3 and close this incident. We had no official patient contacts, and we have handed off this event to DDPHE.
Now, I did talk to DDPHE late this afternoon, and they said that there was ambulances there to help out in that nursing home because of low staffing. They also said that they had to get those ambulances back into service to respond to emergencies as soon as they could, as soon as some replacement nurses, or not replacement nurses, some fill-in nurses were able to come into work. Now, I also tried to reach out to the nursing home. They referred me to the head of nursing and the head of care to call. She has not called me back. In Denver, Michael Abeda, covering Colorado.
All right. I've been a nurse for over 10 years, and I must say, this is the first time ever I've seen on the news where they've announced that emergency departments are closing, ICU departments are closing for the long weekend. To the fact that the news is even telling people don't go to the emergency departments unless it's actual emergency. If this ain't a sign that there's something wrong with our system, I don't know, because that is scary. That is absolute scary. Yeah, this is a real situation. Something needs to be done.
If you got a family member that's in a nursing home or a loved one in a nursing home, I need for you, after you like, share, comment, the whole 9 yards, go, drive, fly, get there by bus, train, hook or crook, and say thank you to that legal immigrant that works at that nursing home that is helping to take care of your loved one. Because I want you all to realize that there is no industry in the American economy that will not be impacted by the current administration's immigration crackdown. Not a single industry. But in particular, did you all know that nursing homes are struggling thanks to the current administration's immigration crackdowns? Do you all not realize that facilities for older adults and disabled people are reporting the sporadic loss of employees who have had their legal status revoked by the current administration? And these same nursing homes that take care of your grandparents, your great-grandparents, your loved ones are in fear that they are going to continue to lose the employees that they need to care for your loved ones. So yeah, so if you got a loved one in a nursing home, fly, get there by hook, crook, boat, or whatever. Shake that hand of that immigrant and say thank you, and then prepare to work with them to help take care of your loved one. Leave your thoughts in the comments. Peace, love, and chicken grease.
To close this important conversation, let us take a moment to understand what this nursing staff shortage really means. Nursing homes are more than just building. They are places where our parents, grandparents, and loved ones receive daily care, compassion, and dignity. Where there are not enough nurses and caregivers, the quality of care drops. It is the elderly and vulnerable who feel the impact most deeply. Family watching this should know that they are not powerless. If you have loved ones in nursing home, stay actively involved. Visit often, talk with the staffs, and raise concern respectively when you see gaps in care. Community voices matter. You can also reach out to local representatives and decision makers. Encourage them to prioritize staffing, training, and supporting immigration policy that allow qualified caregivers to work where they are needed most. To those in leadership positions, this is a reminder. Policy on healthcare and immigration must go hand in hand with compassion. A shortage of skilled caregivers isn't just a static, it's a live reality for families across the nation. Solutions must be found that support both workers who dedicated their lives to care and the seniors who depend on them. Find the Dot family. Thank you for watching this important discussion. Please remember to share this video so more people can join this conversation. Subscribe so you don't miss the future commentary. Most importantly, drop your thoughts in the comment section below. How do you think America can solve this nursing shortage challenge? Your voice matters. Together we can push for solutions that put people and family first. Thanks.